Ladies and gentlemen, welcome to the Slice is Right podcast
Hey guys,
with Dr.
Scott Ogley, welcome.
Board Certified Plastic Surgeon
Indeed.
and a well-known superstar in Scottsdale. And with little old me, Dr. Aldo Guerra, plastic surgeon to the beautiful people of North Scottsdale.
Board certified as well.
Well, thank you.
Of course, yeah. It's a fact.
So our podcast is going to focus on plastic surgery, and we're going to try to make it a little bit more fun than when you go to the consult.
Yep.
Educational, but also a good time.
Of course. That's how we do it here at Guerra Plastic Surgery.
And I think also it'll give you a little light in maybe getting to know the surgeons a little bit better and the office staff when we interview them and give them a little chance to get a highlight. So how are you?
Well, good. I'm excited to be starting doing this, yeah. Talking about, something different every week, help inform people, and like you said, keep it a little more fun than, a little more of the seriousness that we have when we do a consultation.
Yeah, sometimes we're a little bit too serious, guys. Let's face it. Plastic surgery should be fun. We're gonna have a couple of topics today. Mm-hmm. It is the season, so we're gonna talk a little bit about the holiday lights and some other things that are in the news. But we're gonna focus today on tummy tuck surgery.
Yep.
Abdominoplasty,
also known as abdominoplasty. Yep.
One of my favorite operations, actually. How do you feel about tummy tucks?
Likewise, I think we specialize in a lot here at the surgery center, but abdominoplasty is one of our most common, one of our favorite procedures. We do a lot of them here because we love them and because we're good at them. I
agree. I tend to think, for my practice, that, the belly button is what really distinguishes my results from other people. I think my belly buttons look more natural than when you see other surgeons' results. But, tummy tuck is one of those operations that we really pride ourselves into performing.
Yeah, I agree. I think, that's... other than where you place the incision, making sure it's low, the belly button is a huge tell, both the good and bad of a tummy tuck. So taking our time, like we both do, to make a good belly button, an innie with a nice hidden scar, that's the key to a nice natural result that people are going to be happy with.
Yeah, absolutely. So what I think, what I like to tell the patients is that about 6 or 8 weeks after the surgery, they'll be poolside ready. So, that belly button with the hidden inner scar, I think, can look very natural, and people can't tell when you're out on the streets or out in the pool that you've had one.
Absolutely, yeah.
That's really the goal.
6 weeks is when the patients are starting to feel themselves again. They don't need to wear compression anymore. The swelling's starting to come down, so it's a lot quicker of a turnaround and of a near final result where you're feeling like yourself than I think a lot of people realize.
Absolutely. Mm-hmm. What do you think, Scott, is the best time for a woman to do the tummy tuck?
Well, I think the big things, it's a different answer for everybody, but I think some of the big things that every patient should consider is, first of all, the most obvious is going to be somebody who's done with having children, right? Mm-hmm. Most common reason that brings women in for a tummy tuck is after giving birth, after having stretched skin, and they're stretched widened abdominal muscles. So making sure they're done with all their pregnancies and making sure that they're at their goal weight. The last thing you want to do is...
That's a good point.
Yeah, the last thing you want to do is, get a tummy tuck and then proceed to lose a bunch more weight after that. So, done having kids, done losing weight, I think you're ready to go.
Well, I agree with everything that you said there. I do think that nowadays there's way better ways to help people to actually achieve their goal weight there. I see so many more of my patients, and I'm sure, what do you think? You have the same experience where you see them on semi-glutide or Mounjaro. Have you seen a lot of that?
Probably 30% of patients, at least, at this point, are on that. Not even just tummy tuck patients, but in general. Very common.
I mean, look, the struggle is real to lose weight, to get to that ideal number. And, we definitely encourage patients to do that before the tummy tuck. And the real key with using something like semaglutide is to, achieve your goal, maybe go down to a maintenance dose, and then be off of it for about 2 weeks before the surgery for safety purposes. Can you talk a little bit about that, actually?
Yeah, so, it's a new medication that we're still learning a lot about, but what we've seen with especially these new GLP-1 analogs like semaglutide or Mounjaro is that patients tend to retain a lot more in their stomach. So we want patients to be off of that before surgery so that they have less risk of having anesthetic complications from either vomiting during surgery or from after, especially a tummy tuck, where we're tightening their muscles.
Right.
It can worsen that problem.
Right.
So it's best to be safe, but they can start right back up again after surgery's done and kind of not miss a beat.
No, absolutely. Yeah. So 2 weeks is the magic number. It took a little of trial and error to really understand that it takes about 2 weeks. When these medications came out, which happened really during the COVID pandemic, anesthesiologists were trying to find out, is it 3 weeks? Is it 6 weeks that we need to stop? Is it a week? Believe it or not, most patients don't want to stop more than a couple of weeks. They're really concerned about gaining that weight back. But we don't really see that. I'll be honest with you, that I don't see them gain weight. Even if we stop at 2 weeks before and wait 3 to 4 weeks after the tummy tuck, they seem to do really great with it.
Yeah. I think the point too is that a lot of them are already kind of at their goal weight, so they're oftentimes on these maintenance doses that are a little smaller and that are more just to keep them where they're at and make them happy there.
Yeah. What about we talked about moms and how they're after having kids, they don't want any more children. It's a good time to do it. How about weight loss patients? You think they need to wait that long, or maybe when they achieve their goal weight, 100 pounds, 80 pounds?
Mm-hmm.
You think they need to wait to have babies, or have a traditional tummy tuck, or more of a
that's
modified?
I guess that's a different answer for different people, depending on how sure they are they're going to have kids.
Yeah.
How long until they have kids?
Sure.
I wouldn't say don't do it if they're bothered by something that they see on their body and they want to fix it. Mm-hmm. But the reality is too, they might need something additional in the future if they get a tummy tuck and then have children after that.
Yeah. No. I definitely think that once a weight loss patient has achieved their weight, they're stable for about 6 months. That's when they can have the tummy tuck, and especially if they're either not planning to have kids or it's gonna be 10 years perhaps before they have children. They can get a more traditional tummy tuck.
Exactly. Yeah. I think that's reasonable.
All right. Well, let's talk a little bit about muscle repair. How much muscle repair do you like to do?
Well, I personally like to put women back to anatomic midline. So I tend to not overcorrect it too much, because especially these thinner women where, you want to see a nice midline kind of a gentle rivet there that shows like a definition that the abs would have had prior to pregnancy.
Yeah. No.
So I tend to put them back to anatomic midline. I don't overcorrect unless they have a little bit more thickness to their skin and their fat, and then it would hide that overcorrection there. Yeah. I don't know. What do you think about that?
Well, we're seeing some samples of our work here, and it brings up a good point. What happens during a tummy tuck? We know we take a lot of skin off. We definitely tighten the muscles on a lot of our patients. I would say 97% of patients, unless there's a really good reason not to tighten their muscles, like they're going to have a baby in the future.
Sure.
We want to go ahead and tighten it. And I do a pretty aggressive repair, probably a little more aggressive than you. I really want to tighten them, overcorrect them a bit in the midline, and then I do the corset as well. We'll talk about the corset in a minute, but the muscle repair, what stands out to you about the muscle repair the most? What do you think?
Well, first, that's that tummy tucks aren't just about flattening our patient's skin externally. It's about flattening them internally, because a lot of women come in and they might not have, just like the picture we just showed recently, they might not have a lot of excess skin.
Sure.
What they have more so is this bulge, this abdominal bulge that almost looks like they're pregnant.
Yeah, absolutely.
So it's like, it's not just cutting out skin that you can pinch with your fingers that's part of a tummy tuck. And I would say in a lot of women, it's the less important part of the surgery than bringing their muscles tight, helping strengthen their core.
Yeah, absolutely.
It helps back pain for a lot of women. I would never say that that's the goal of this surgery, but a lot of women report that they're getting this extra benefit from it.
Yeah,
what would you say?
Well, that's been published before about the back pain, but there's a lot of benefits to the muscle repair that are not just the aesthetics. Of course, everybody loves looking great.
So what we do a lot of aesthetics.
But when you go to the gym and you can do sit-ups and crunches and keep up with the bicycle ladies, the cycling ladies more aggressively, then I think that's a win for everybody.
Yeah, of course.
Sure. Getting your core strength is really nice. What I was going to say is, how about the pain? What can we do about the pain and to decrease the pain with muscle repair? Let's talk a little bit about that.
Well,
what are your thoughts?
You have your career span longer than mine has. I know you've probably seen a lot more of this early on, where what I saw early in my career was that women that got tummy tucks, this is often the most painful surgery that we would do, where women were in excruciating pain for a week or two after surgery. Often we were putting in pain pumps to help minimize that pain. That was before a new medication that we have that's called EXPAREL,
that's nice.
That I really do feel like changed the game for this surgery, where we can inject this anesthetic that lasts for more than just a few hours. It lasts for a few days.
That's a really good point. So I did used to use those pain pumps. They were a hassle to use.
Yeah.
You got these wires going into your
You have
body.
another drain too.
It looks robotic a
Yeah.
little bit. It's more things to, that the patient has to worry about when they get up and walk.
Mm-hmm.
With EXPAREL, we don't have to worry about any tubes going into the body, and EXPAREL just, stays in the tissues, and it's really nice. Because what you put it in and you get a 4-day relief of pain. Most studies show that it reduces pain 55%. Something similar to that number.
Yeah.
The other thing that I've seen, in addition to, being around when we were using the pain pumps, we would prescribe a lot more narcotic pain pills,
yeah.
40 higher doses. We've learned so much about narcotics and how dangerous they can be, addictive they can be. We can calculate the daily dose that's safe for our patients. And so one of the things that I've seen with EXPAREL is we're giving them maybe a third of the pain pills that we used to, a lower dose that's safer. Much harder for a patient to become addicted because of the lower narcotic doses. So I think it's a wonderful medication, EXPAREL, actually, and it's something that I really love that has really changed the game for us. Yeah,
I even more than that. The big thing, just minimizing narcotic use has been huge for minimizing constipation, discomfort, and just overall. Narcotics only help for so long before they start to hurt patients.
Yeah, absolutely.
But furthermore, just patients that have better pain control with these with this EXPAREL, they're more likely to get up and move around more. They're more likely to walk, less likely to get these complications like blood clots. So I think it extends even beyond just like good pain control. There's a lot of other benefits that women are seeing more than just their comfort and their narcotic use, and that's why we use it on every one of our tummy tucks essentially.
Yeah. So quicker recovery is what Dr. Ogley's pointing to, quicker recovery and get back to normal activities and a little faster than in the old days. So
Definitely.
Good. How about drains? How do you feel about drains?
Drains. I personally use a drain. I know you're in a similar
I do too.
Similar stance. I think a lot of these, especially more recently, where I hear about more drainless tummy tucks. I think there's a role for it in a certain patient population. We do it sometimes, but I know that there has been some new literature that shows the rate of fluid collections, or seromas as we call them, after drainless tummy tucks are quite a bit higher than if we're using a drain. So a drain it can be annoying for patients. I view it as a necessary evil for the most part. It just typically is in for 5 to 7 days. In my experience, I think you're probably similar.
Yep.
And it takes away a lot of the risk of those fluid collections that can be annoying for patients afterward.
So here's what I think. I definitely drain. I wouldn't say that it's an evil. I think it's a necessity because I've seen it. I've done both ways. Maybe before you got here, I used to do some of the drainless. But what I found is the patients look and feel a lot more swollen. They look puffy. They feel puffy. And the other thing that I didn't like about the drainless approach was they tend to not achieve the look that we're going after. Both the patient and I are going after. Because of the swelling, it makes them round instead of curvy. It takes longer for that to really apply. And of course, there's about a 2-3% chance of getting a trapped fluid collection of seroma. When with a drain, we're not getting seromas.
Yeah, they're much rarer.
We're doing a better job with that. And so I think it's a huge benefit with regards to that. The one thing about the drain is we got to make it easier for the patient to drive the drain, control the drain. So I used to put the drain in the pubic area, which probably a bad idea. I think patients really hated that spot. It would leave a little tiny scar there, and it was just
there as well.
It was uncomfortable and sometimes painful. But if we put it off to the side like we do now, I think both of us do that technique, right?
Yes, I do the same spot as you. I think it's just easier. It's out of the way.
Yeah.
It's as little annoying to patients as it can be.
Right. It's almost not there. Plus, when we put the offsite, it's low maintenance. They really don't have to do any work to keep it going.
Just recording the outputs.
Yeah,
it's
absolutely.
Just writing numbers down, emptying it out. It's a simple formula for success with those. So that's why I it's not a broken problem. That's why I don't seek to try to fix it, because I think it's a necessity to minimize complications afterward.
Yeah, no, absolutely. So a lot of swelling with the drainless technique. I don't see a big benefit. I love the curves that we're getting on our before and afters, and I think we get there faster with a small drain for 5 days on average. Yep. That still allows us to do a rapid recovery. So
I would say so. That and the EXPAREL, it's got it down to science here.
Well, let's move on. There are some other things that we can do to tummy tucks to give them more curve, and I know that I'm a big believer in the corset tummy tuck. And how do you feel about the corset? You feel like it makes a difference? Or not really?
I mean, the corset is just another level of basically plicating or folding the muscle layer of the abdomen over on itself to tighten it, to make it look more curved and just bring in the waist more. So it's
Look at this
it
picture
can't help
here.
but make a better contour.
So this is one of our patients, and what we see here is that she's got some curves all the way around that waistline. Looks really nice. And you can also tell, the secret in the before pictures is that she went to a different surgeon, had a lot of liposuction, which looks very aggressive, doesn't it? Looks
It's a little more aggressive. You can see some of the hallmarks of liposuction, but certainly it started her off at a better position to have a nice result with a tummy tuck with better contouring.
Yeah.
And the tummy tuck does help a little bit with that contouring as well, tightening the skin and showing less of those like hallmarks of previous liposuction.
So, what I like about this result is that she's got lovely curves. She's got some abdominal definition. Looks like she's been doing sit-ups.
Yeah, that nice little midline right there with a little little indent there looks beautiful.
Right, and then that muscle repair really, gives her not only a very flat-looking tummy, but a tummy that looks athletic, attractive. So it's very good. So I'm a big fan of the corset. I sort of introduced it into my practice, a little bit gingerly because I thought it would create more pain, more discomfort, doing more muscle repair. But it turns out that with the EXPAREL, you really are nullifying that.
In the setting of EXPAREL, I think it makes sense.
Yeah.
It is another plication of fascia. So in the days before EXPAREL, it certainly would have caused more pain and more just discomfort in these patients. But where we inject the EXPAREL for the midline repair of the muscle, we're injecting it where you do the corset part.
Absolutely.
And so I think it's helps get you better, more curve.
Yeah, that looks quite lovely. And let's talk about some other sort of odds and ends with tummy tuck. You know about the reverse tummy tuck, yeah?
Oh yeah. Uh-huh.
What do you think about that?
Well, we get patients asking about it sometimes because it's I think a lot of patients just hate the idea of scars. They would want to sacrifice some quality of result or some contour just to minimize how many scars they're going to have. And what the reverse tummy tuck is it puts a scar in the folds of the breast, which some women might already have scars there if they've had breast lifts, breast implants.
Right.
So I could see how it could be attracted to some people at the surface on face value.
So if you guys out there can imagine what happens with with the reverse tummy tuck, instead of pulling down, which is a traditional tummy tuck, we're pulling up against gravity, right? And that triggers a little bit, saying again, anytime you use plastic surgery to fight gravity, where we live in this planet, we're going to eventually lose that battle.
It is a losing battle.
It's a losing battle.
Yes.
So if we're pulling up instead of down, where it makes more sense, you're going to get some mileage. You're going to get a few years, and eventually that skin is going to become loose. But the biggest problem, I think, is if that same patient who has a reverse tummy tuck wants to wear a low-cut dress or a bikini that shows the cleavage area, and right below that cleavage area is going to be a scar that goes across the midline, it really loses its sex appeal, I think. Don't you think?
Even if you might minimize a little bit of scarring, you're putting the scarring in a much more delicate and hard-to-hide area. So to me, just because you might save a few inches of an incision doesn't really matter if that scar is front and center, hard to hide, something you see all the time. And that's what I feel like is the case with the reverse tummy tuck. I just, I don't really get it much. I see the value in some certain patients, but most will do far better with a traditional tummy tuck with a low scar hidden at the lower abdomen.
Yeah, and I can tell you, I personally believe that I've done just 2 reverse tummy tucks in 20 years.
I've done 2 as well.
Yeah, well, you're a little faster than me then, because you haven't been in practice for 20 years.
But I'm not sold on it. So I mean, it works. It looks good, but it doesn't work as well in most people, I would say. And furthermore, I think patients tend to think that they want a reverse tummy tuck because they see most of their excess, these patients, in the top part of their abdomen. The reality is a traditional tummy tuck, like we do a large majority of, it still tackles that skin up at the top. It just, in the technique that we normally do it.
Right. Well, with the normal approach, we hide the incision under your undies. You can wear a bikini, a two-piece.
Exactly.
In a lot of patients, because the incision's so low. So why put that scar up at the top? I don't see any big benefits. No. How about liposuction? You like to do lipo?
Probably 99% of my tummy tucks, I do it.
That's a lot. Yeah.
I mean, it's just, in plastic surgery training, you're taught you want to take care of an entire unit of the body. So the torso is a single unit. So when you're isolating and just doing a tummy tuck, you might be leaving a lot more behind in the flanks, the back, the bra line that's going to make that result look forced or look a little bit less natural. So by taking care of the entire unit, the entire torso, you're addressing the entire portion of that body, and it just tends to look a little better in my mind.
No, absolutely. Part of the the reshaping that you see in our results, those curves, those nice smaller waistline, that is done with liposuction in addition to the tummy tuck. Yes, you got to get the underlying muscles to be just right, but with the liposuction, you can really like adding an exclamation point almost to the result. So again, I'm with you. 99% of my patients get liposuction. Occasionally, you'll get a patient whose body mass index is 17. Is basically skin and muscle.
And sometimes that's the case.
Yeah, and then you don't have to really do too much.
Yeah, it's an easier recovery. It's less pain. It's a quicker surgery, and so there's not always a need, but most of the time, I think there is.
Any type of lipo that you like to do? Any particular technique?
I mean, the liposuction that we typically use is either power assisted or just suction assisted. I try to shy away from things like laser or ultrasonic because certain complications are higher. You might get a slight bit more skin tightening, but to me, if you have loose skin and you're trying to quote unquote get away with liposuction, you should really be considering another procedure. And I know you're big on that too, of not getting away with stuff. You should be considering a procedure that's going to remove skin. Right. I don't want to get by with liposuction. I want it to be on the right patient who has good skin quality. And I think for most patients, suction-assisted and power-assisted liposuction is the answer.
Yeah, absolutely. I love my power-assisted lipo machine. It's, I own my own machine, so I use it everywhere I go. Mm-hmm. I think it just saves so much work and physical stress for the surgeon, but also we know that device is vibrating, it's moving, it just is so much more efficient at removing fat. And, it's nice to tell the patient that you've done the best effort to remove the unwanted fat, minimal blood loss, and it's very, very nice. Yeah. Mm-hmm. Well, let's talk about some special patients. Let's just go ahead and talk about the extremes of the body mass index, right? Yeah. We've got patients who have very tiny body mass index, 18 and less. And then we have patients who have very large body mass index, let's say 35 and above, maybe even higher. What are you comfortable with in terms of a BMI?
I mean, I think 35 is, we have not only good literature to support that patients that are under a BMI of 35 are just safer for surgery. So I kind of tend to follow along with what our evidence shows. And what my experience shows is that patients that are under 35 tend to look better with their results. With a BMI of 35, tend to look better post-surgically. They tend to have less risk of complications. So that's where I tend to lie. It's about 35 BMI or less. Yeah. What do you think?
Yeah, I like that number. I think I've done some patients 37, 38, 36. It really depends on the clinical scenario as well. So just off the top of my head, the patients who have had higher BMIs than 35, they've all been completely healthy. No diabetes, no high blood pressure, relatively young, and just struggling with some of their weight. And also, their intra-abdominal component wasn't extensive. They had a bit more of a pear shape instead of an apple shape, and that's an important point because when you try to force all that abdominal fat into the cavity, it really restricts breathing.
And I think it limits your aesthetic result too. It's
absolutely
you can't the fat that's around your organs we can't really target. That's only by weight loss. So that's another reason to make sure you're at a weight you're happy with because now you've controlled for all that fullness intra-abdominally that we have no ability to correct at all. We can tuck it in, we can hide it a little bit, but we really can't. We can't tackle it hugely.
Are you a believer of measuring the peak pressures or the intra-abdominal pressures?
I do it on every single patient. It's surgery is not just the surgeon; it's the anesthesiologist, it's the entire surgical team. Before I plicate, before I fix the abdominal muscles, I always ask my anesthesiologist what the pressures are in the abdomen that they can measure through their the breathing circuit. And I follow it along as I start to tighten the muscles. And, I want to make sure that the pressures in the airway in the chest don't get too high to where it's going to be a problem for the patient's breathing after surgery. Breathing is, is important. So we don't
really
want to mess with that.
Yeah. No, I think, that's such an important point that you just made, that it's really about the team that's there and about keeping the patient safe. So
number one here is safety. Beyond any aesthetic result, beyond anything, it's you have to be safe.
Right. So what you can see when you're doing an operation like a tummy tuck is that there's a certain amount of pressure that's created inside the lungs from the anesthesia device, the anesthesia machine. And when the muscles are tightened, that pressure goes up. And there are certain numbers that a human body can tolerate. And, that is a very good guide for surgeons to be able to safely plicate and tighten those muscles, get you the result that you want, but at the same time not raise the peak pressures to a point where it's just too high.
It's going to be problematic afterwards.
It's going to be problematic. So we do that on every patient, and I think that's a smart way to work with the team to assure that the tightening of the muscles is right, but not overly done.
Exactly.
So safety first, and then I think the point that you were also trying to make is that when the body mass index is higher, there's going to be more resistance from the volume, the fatty volume around the liver, the kidneys, and so the pressures can be higher in patients who have a higher body mass index. And the logical end result of that is they can have a little bit harder time breathing, and so they may need a little help, right? They may need a little oxygen, or maybe some bronchodilators, maybe even an admission to the hospital if we're not keeping an eye on that.
Yeah, they're taking less deep breaths. Their lungs are expanding less. It can lead to pneumonias, and it's just going to complicate surgery that we want to minimize complications with. This is elective surgery, so we want to all our T's to be crossed and I's to be dotted, so that patients do the best that they can, and that we modify all these risk factors that we are able to modify.
And then with that, we can circle back to semaglutide, Imonjuro, generic tirzepatide. So therefore, if you're struggling with weight, we can set you up with a clinic that can help you, get you to a lower body mass index where we are going to actually do wonderful positive body changes for you and keep you safe.
Yep.
Now, let's talk a little bit about how we can change the surgery for patients who were heavier. They've lost the weight. What do you know about extended tummy tuck, fleur-de-lis, right?
Yeah, I mean, they're all kind of different sides to the same coin, where it's a tummy tuck. It's taking out excess skin of the abdomen to make a flatter, smooth contour. Oftentimes, more commonly for patients, that excess volume can be cut out just with a transverse or a horizontal scar that kind of goes low around the pubic region and has a nice gentle curve to it. Sometimes patients have skin excess that needs an incision that goes pretty much directly through the middle, up through the abdomen.
In addition to the tummy tuck.
In addition to the traditional scar.
Right.
To take out skin excess that exists in the other dimension as well, where we're cutting out a ton in both dimensions. Something like that right there is a great example.
There's a great example.
A great result also, Dr. Guerra.
Oh, thank you. So let's look at that preoperative photo a little bit more in detail. So what you see is quite a heavy skin flap. So that's going to feel really like a wonderful accomplishment when you take that off the body and the patient
very
is
satisfying.
20 pounds lighter. I would say 15 to 20 pounds lighter is probably what they would be. And the way to determine whether you need an extended tummy tuck versus an extended tummy tuck with a fleur-de-lis component is to assess whether there's just vertical excess and horizontal excess, right? So if there's only vertical, extended tummy tuck will do the beautiful job. If there's a component of horizontal along with that much extended, you're going to have a fleur-de-lis, which is, as you guys can tell, is what we did there. Beautiful scar, too.
Yeah, you can see her kind of that skin excess hanging over onto the sides near the hips. There's no way to really get that out with a tummy tuck, a traditional tummy tuck scar. You've got to pull that in so that, her profile, her silhouette is already half the width that it was just by pulling it in that, in the vertical way, which really, really ties it up nicely.
Yeah, and, we actually, both of us, love doing extended tummy tuck, the fleur-de-lis. We love the weight loss patients. It's part of our practice that we think is so important into the work that we do, and so
it's so transformative too. It's just it's very professionally satisfying, and
absolutely,
more importantly, it's the patients are just super ecstatic and just do so well and are so happy with it. So that's why I love it.
Yeah, and then these patients can still have their muscle repair. They can still have their EXPAREL and have a quick recovery. We might have to use 2 drains in an extended case. That's one of the caveats. Again, we're going to put them out to the sides. Not always.
Only if we need to.
Yeah, one of the things that we haven't really talked about is, we get rid of some of the space. Both of us, I think, do this, right? Where we suture the skin back down to the abdominal muscles. Yeah. Some of us... I like to use a lot of sutures to do that. You like to use a little bit less.
Yeah, I use at least 4 or 5. At some point it starts to cause a lot of pain for patients if there's a lot. I worry that some of the tugging can sometimes increase the risk of bleeding. So I tend to find a nice happy medium where I feel like it's tacking that skin flap down to the muscle layer without overdoing it.
Yeah, so what we're talking about here out there in the audience, we're going to elevate the skin away from the muscle. We're going to do our muscle repair at the bottom. And then we got to put that skin back down. You can just lay it back down, or you can suture it in place, and you get rid of that space. You don't need a drain there, and it gets rid of that soft tissue potential space where fluid can collect. And so if we can avoid getting any fluid collections, it's a winner.
Yeah, we'll take
And
that every day.
the traditional name for that is called Pollock sutures.
Yes,
Yeah,
or
so,
quilting sutures,
yeah,
like a quilt. You're
so
tacking down at regular intervals.
So Dr. Pollock and his son described that many, many years ago in the 80s, I believe. And ever since then, people have developed different suture techniques. Yep. You can use traditional Vicryl sutures. You can use some of the barbed wire sutures,
Many ways to do it this effectively.
But it is a nice technique that we do on everybody so that we can get them to heal faster as well. How about that belly button on the fleur de lis? You like that result there?
Yeah, and belly button, with any tummy tuck we do here, our goal is to get that belly button scar to be hidden inside. Yeah. It is a hole that is ripe for hiding stuff in. So if we can hide that scar internally rather than sitting outside, protruding out of the belly button where it's a stigmata of surgery where it's very obvious that you've had surgery done, well, that's a win if we can hide that. So in that case too,
and then
we've tucked it in well.
There is a little bit of a myth that maybe some weight loss patients have talked to me about, and that is they can't have a normal belly button after these kinds of surgeries.
It's not true.
Some people don't have a belly button at all. I mean, I've seen that in other works, but I do think that let's think positive about that. You can create a nice looking belly button that goes right into that fleur de lis vertical scar, and it can look natural and beautiful. Yeah, and then do you have any tips for patients? What do you do for belly button care? I think I do a lot, but how about you?
Yeah, I think we are similar in that regard. I will pack the belly button early on with some gauze that have a little Vaseline impregnated into them. That helps the incision heal better with the hydration. It also helps stent the belly button open so that it stays at a certain size and doesn't contract down. And it just tends to help protect it so it doesn't get beat up with the garments they're wearing and with the activity that they're starting to do.
Yeah, I know. A lot of surgeons, I tend to think, sort of forget about the belly button. They just think it'll just come along with the rest of their tummy tuck. But we actually have a specific protocol. We like the Zero-Form gauze, Vaseline impregnated. Vaseline back in the old days used to be called healing ointment, and it does that. It gets wounds, especially superficial wounds, to heal much faster because it traps a little bit of moisture on top of the incision, which your cells can take advantage of and heal faster. But we do that for about a month to get the swelling out of the belly button. It works really nice, and then that same Vaseline gets the incision to heal really very atraumatic, very thin, and
I've had great results with it. I'm not changing that because it does well with it.
When the biology of that goes really well, you're pool ready in 6 to 8 weeks, and
truly,
people are going to have a hard time telling that you've had a tummy tuck. Yeah. All right. Well, let's move on to the Mons.
Yes.
Yeah, not the race in France, but
no.
That's Le Mans actually.
Le Mans,
but
just the Mons.
Just the Mons, right? Because a lot of people don't think that tummy tuck includes Mons work or Mons plasty or sometimes the patients refer it in a cute way, the fupa plasty.
Fupa,
right?
yeah, exactly. I mean, it's tummy tuck is a tummy tuck is a Mons plasty. They go together. When you pull skin down in the tummy tuck to tighten, it's just how force works. You have to pull up too. So you get every tummy tuck not only pulls the skin tighter of the abdomen, it lifts the Mons. It tightens that pubic area to make it flatter.
I agree that every one of our tummy tucks does that, but as a surgeon, you have to really think about what the Mons should look like after a tummy tuck. And the way that I think about it, Scott, is that, I'm trying to replicate what the patient looked like before babies. Maybe when they were 17, 18, what do we see about a pubic area? That it is small. It is not very long or stretched out. It is, facing the world forward is what I like to call it. And what we see in a woman after babies is that Mons is longer than it used to be. It oftentimes has stretch marks on it as well.
Sure.
And it's kind of pointing down. It's kind of has a sad look to it.
Sad, yeah.
And so I make an effort to make my incision as low as I can to be able to pull that pubic area up so it's once again facing the world. It's short from the introitus, the opening, of her private parts. It's about 5 to 7 centimeters. And then
Exactly what I do.
really, really important, because patients don't ever want us to forget about that, is that there's some subcutaneous fat there too.
You can take out right when you're
Right.
the hood is open. You can see everything. You take it out directly.
Right.
You can control that.
Right, and it's the fatty volume in the pubic area is usually reflective of the body mass index. It kind of goes along with that. So if you have a low BMI, there's not very much. We
Not
probably
much to
don't
deal
have
with.
to do any liposuction there, but I like doing liposuction there to really bring it down.
And I'll
Yeah.
typically do it with like direct excision, but it's the same end result,
Right.
which is less fat, a smoother. So it transitions from the abdominal flap up to the pubic area. It's nice and smooth. There's not a big divot there or a lump or kind of a split level appearance
Right,
to it.
right. We don't want to step off like that.
No step off.
And we don't get those. We really work hard at that. Plastic surgeons traditionally we have cute names for everything. So, and we're always thinking about food.
Yeah.
And so we call that part of the procedure depuffing the muffin. Okay.
Oh
everybody?
yes, of course.
Yeah.
That's what
So
it is.
it's a step that we never want to forget. With a name like that, it's unforgettable.
No.
Really.
And
it
you
really
will
is.
remember it every time.
So taking down the subcutaneous fat there is really important. The one thing that we have to watch out for is small hernias. And so we always routinely check for small hernias there in the inguinal area. Fortunately, that's pretty unusual these days.
Not as common. We'll check
Yeah.
it preoperatively. On your exam and the preoperative time, we'll check to make sure there's nothing there, and we'll mind it and be careful in case there's anything that we can't feel when we're doing the surgery.
Well, I think that's been a really good discussion on abdominoplasty, tummy
Exhaustive,
tucks.
a little bit of everything we talked about. Yeah.
We've talked about the MONS, the liposuction. Let's talk, before we put it away, let's talk about a couple other things that we like to do to improve the experience, reduce the risk for the patient. So what do you think about this medication that's pretty new on the horizon here called tranexamic acid?
Yeah. I mean, I think it's kind of it's an exciting medication that we're now finding out with a lot of the literature that's coming out in plastic surgery that tranexamic acid is pretty helpful for a lot of stuff that we do. What it does is it basically minimizes bleeding risk. It lowers your risk of bleeding without increasing your risk of blood clots, which meds that often decrease bleeding risk can increase clotting risk. But this is one of those medications that kind of has the best of both worlds. So it's being used a lot in facelifts and tummy tucks and breast surgery, kind of all over the place now, and in a lot of different realms of surgery too, spine surgery, neurosurgery. It's great.
Well, I know that our ortho bros really
Loved it. Yeah.
Those guys are using it before the surgery starts, as the surgery is ending. They're definitely given about double what plastic surgeons are using as a standard dose. I don't use it on everybody. I selectively apply it to maybe some of my bigger cases.
Yeah.
I'll tell you,
higher bleeding risks.
my top three are breast implant exchanges with a capsulectomy. Definitely with my tummy tucks and lipos.
Every tummy tuck.
Yeah. And then some breast reductions, breast lifts.
Sure.
I think that it definitely helps to reduce blood loss, drainage. I think it's also made it possible for me to really feel comfortable not using drains with breast lifts and breast reductions like I used to use drains in those surgeries in the past. But with tranexamic acid, it's almost like a wonder drug.
Yeah, I think even for like on my end too, facelifts, a surgery where bleeding is stopping bleeding is very critical, as bleeding in the face can be dangerous for being able to breathe. And faces tend to want to bleed more because they have more blood flow. So it's been great for facelifts as well, and it extends to the body work that we do also.
Yeah, so a lot of patients don't know about this medication because it's not one of those big pharma things. It's an older drug that's off patent, and somehow it's just made its way back into the hospitals, into the surgery centers. But it is a nice little addition. So just be aware that we are keeping up with the literature, all the new publications, and we're introducing things that can definitely lower your risk. What else can patients do? Tell me a little bit about walking. What do you think about walking after surgery? How important that is after a tummy tuck?
Yeah, I mean, it's paramount. It's, walking after any surgery, especially surgeries like tummy tucks, where risks of blood clots can be a touch higher than the other surgeries we do. It's incredibly important. It helps keep blood flowing in the legs. Flowing blood is less likely to clot. And we usually pair that with things on our end, like a light blood thinner for 3 to 5 days after surgery to just help keep that risk as low as we can make it.
Right, yeah. So, and I think that brings up another point, Scott, and that is that, I tend to think that patients do well better when they go home after a tummy tuck than when they stay overnight. Although we do offer that as a VIP
Of course.
experience. But, I find when I talk to the patients afterwards, and I don't know if you do the same, but they tend to be more comfortable in their own bed, in their own bathroom. They tend to
familiar
walk
setting.
a little bit more. They go to their own kitchen and make their own food. When you're at the surgery center in the overnight, the nurses kind of guide when you can get up and in and out of bed. But walking is probably the way to prevent blood clots.
More than anything.
The medication Lovenox helps to reduce the risk. The compression socks help to reduce the risk. But if you don't walk, I don't think
Nothing
you're gonna
replaces
get there.
walking,
Yeah.
truthfully.
So,
Yeah.
and again, that's what's a beautiful thing about tummy tuck. It's not a surgery where you're going to be laid up in bed for 2 weeks. It's one where you're going to be moving
because
and
you have
grooving.
to be.
Yeah.
Yes, you have to be.
Yeah.
Yep, I agree.
What are your plans for the holidays?
Well, I'm going to Hawaii on Tuesday, so spending Christmas in Hawaii. Always wanted to do that.
Wow.
But we've been doing a couple other things around town. Like I know something we want to chat about, including like it feels like the holidays here. Because it can sometimes feel like, we're in the middle of the desert. You want to sometimes be taken away from that and pretend like you're in a winter wonderland kind of. So have you checked out the Princess yet?
So we tend to go there quite a bit.
Yeah.
We've gone there for the last few years with the kids. I love the lights there, actually.
Oh, it's like 10 million of them, I think. It's crazy.
Have you ever, here's a picture of the princess.
They wouldn't let me on that. I'm too old.
You're too old to get on that train?
I just walked, but yeah.
How about just driving it?
Yeah.
Will they let you drive it, you think?
Only if I steal it.
Yeah, so that place is one, and it's just right up the street from us.
Yeah, no, I know. This is my first year checking it out. It was awesome. It felt like the holidays because when it's 80 degrees out, it doesn't really always feel like Christmas time. But
so you're on Christmas night. Christmas Day, Christmas night. You're going to be in Hawaii.
Yeah,
Or you're going to miss out on the fireworks. Then,
I know.
At the Princess. Yeah.
Yeah, but they'll have plenty of fireworks in
you think?
Honolulu. I hope.
All right.
I haven't looked that far ahead. But.
Yeah. How about? Yeah, I know you're big into plants, right?
Yeah, love plants.
You've been to the botanical gardens?
Many times. I haven't done the holiday one yet here, where they have a lot of the lanterns, kind of. I've been meaning to check it out though before I head out.
I think it's cool. We did it a couple years ago. It's really nice. It's really
it's just a beautiful place during the day, but nighttime it's just it's I think it's the prettiest part of Phoenix, right over by Papago. Beautiful mountains, beautiful scenery. You can't beat it.
Yeah.
Yeah.
Yeah. Nice.
Yep.
Did you decorate your house?
No, I have a tree, but that's it. It's too.
Just a tree. That's good.
There's not enough room for anything else. I have too many plants.
You have too many plants. Yeah.
Yeah.
Yeah. Well, we didn't do our home, but my dad did his, and it's crazy.
Oh yeah. They went all out.
Yeah, he goes all out. All the time,
we'll have to check it out.
Yeah. Unfortunately, he needs help with paying the electric bill later.
Yeah. That's where you come in.
He's retired. Yeah, that's where I come in exactly. Now it's not all good news. There's somebody yesterday stole our Grinch costume. I know that's your favorite costume.
It is. I love.
You love the hair that sticks to you. Yeah.
I love wearing it around and just being a little Grinch.
So hopefully we'll get it back after the holidays. I think it's been borrowed without permission.
Has it?
Is what
Okay.
I would say.
Well, I mean, it better come back because I'm gonna miss it otherwise.
But did you hear about this Tempe porch pirate?
I mean, I heard a little bit that this some people just want to steal everybody's gifts for themselves and not have to put any work in. It's a shame.
Yeah, and you live close to there. Were you worried about that? Somebody stealing your Amazon packages?
No, we have a package room where I live, so it's
nice.
they're secured. But I'd keep an eye out regardless. Hopefully they're catching this guy. Or they caught him.
No, they caught him.
Oh yeah,
they did. Yeah, it was actually really cool. It was like a super high tech approach. They had some fake packages with a little transmitter. So I think the guy even got home. He felt it was in the clear, and then they showed up at his house. Yeah, they got him.
Good. I love their sting. We need to bring cheer to the holidays, and it's stealing packages is no way to do that. Don't be a Grinch. Unless you're wearing a Grinch costume.
Don't let anybody. Don't let the Grinch steal your tummy tuck.
Nah.
Okay. No. It's not. It's a little too late to get on the schedule now. We're pretty busy in January as well, but we are looking to, make sure everybody gets their dream body for the summer. So a good time to have a consultation is going to be in January, so that you can get ready.
Looking for February. Recovering by early summer. Summer starts early here, so you got to start thinking soon. You know? It's not July or August. It's May.
Think about the temperatures last year, how hot it was. I mean, summer's going to start really early. Even now, today's going to be 74 degrees. So
you might be at the pool by February this year. Who knows? I hope not, but it's coming.
That's just pressure for us to make the belly button look even better faster.
Yeah.
So.
Beach bikini ready. We got you.
Well, everybody, I want to thank you for our first podcast ever for
Yeah,
the
thank you
Slices
guys.
Right.
Thanks for listening.
It's been an experience to get this room ready and to get ready for you guys. But we're happy to do it. We're hopefully you'll get a lot of educational material. If not, come and do a consultation with us. We'll give you more information. Both Dr. Ogley and I are ready to see you. Excited. Tummy tuck is probably one of our top surgeries. We're also known in Arizona for a lot of breast augmentation. So let us know if you need our help, and if you're thinking about plastic surgery, then follow us on the podcast at The Slices Right. Follow us at AZ Breast. And also on Instagram, we're at Scott Ogley, MD, and Dr. Aldo Guerra if you need to see some more before and after. So thank you for your time.
Thank you, everybody. It was great chatting. Have a good one.
Whole life's ahead of you. Can't waste it groping into the past.
We do it right.